Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com, the 5 best supplements for IBS according to a GI dietitian, Verywell Health, Reese Harrington /R/N/R/N. People with irritable bowel syndrome, IBS, know the challenge of finding treatments that help them feel better and reduce the condition's impact on their daily lives. Though dietary changes are recommended as a first-line approach, some people find a multi-pronged approach that includes supplements to significantly improve their IBS symptoms. /R/N/R/N. When it comes to using supplements, it depends on your specific symptoms, says gastroenterologist Laura Fredo, MD. The best way to know which supplements would work best is to speak with your gastroenterologist or GI-trained dietitian about your case. In recommending the top IBS supplements on the market, our registered dietitian, who has helped thousands of patients manage their digestive conditions, reviewed the latest research and clinical guidance from fellow experts in the field. /R/N/R/N. Our team of registered dietitians reviews and evaluates every single supplement we recommend according to our dietary supplement methodology. From there, a registered dietitian on our medical expert board reviews each article for scientific accuracy. /R/N/R/N. There are many different types of supplements for IBS available on the market, and matching your symptoms to the appropriate product will help you get the most benefit. /R/N/R/N. Always speak with a healthcare professional before adding a supplement to your routine to ensure that the supplement is appropriate for your individual needs, and to find out what dosage to take. /R/N/R/N. Amazon /R/N/R/N. Most evidence for IBS symptom relief. /R/N/R/N. Suitable for all IBS subtypes. /R/N/R/N. Fast acting. /R/N/R/N. Large pills. /R/N/R/N. Active ingredient, peppermint oil, L-menthol 83 mg, form, capsule, standard dosage, 2 capsules, 180 mg each. /R/N/R/N. IBGuard is our top pick because peppermint oil is the most research-backed supplement for managing IBS, plus it's well tolerated and safe for most people to take regularly. Scientists have specifically identified that peppermint oil, which includes the active ingredient L-menthol, derived from the herb Mentha pepita, can relax the muscles in the GI tract that affect pain sensation. Clinical studies have proven that when taken orally, L-menthol has therapeutic benefits for IBS, including major reductions in abdominal pain, cramping, urgency, and bloating. /R/N/R/N. New research has found that 97% of people with IBS who took this specific form of peppermint reported improved bowel regularity, and 87% reported reduced symptoms when eating. Just one dose, 2 capsules, of IBGuard daily can prevent IBS-related abdominal pain, though up to 3 doses are recommended for more severe symptoms. When taken 30 to 90 minutes before meals, IBGuard can also work to reduce food-associated symptoms such as cramping and urgency. /R/N/R/N. When it comes to peppermint oil supplementation for IBS, not all forms are created equal. Peppermint pills that are not enteric-coated, which helps them survive stomach acid, peppermint essential oils, and peppermint tea have not been shown to be effective therapies for IBS. In contrast, enteric-coated capsules designed to target the small bowel have been proven to improve gastrointestinal symptoms across IBS subtypes. /R/N/R/N. This supplement may not be a good choice if you have trouble swallowing large pills. It also contains gelatin, so it's not suitable for vegans or vegetarians. /r/n/r/n Amazon/r/n/r/n broad spectrum for multiple common IBS trigger foods /r/n/r/n helps reduce dietary restrictions /r/n/r/n suitable for all subtypes of IBS/r/n/r/n less widely available /r/n/r/n more expensive /r/n/r/n active ingredient, lactase, alpha-galactosidase, endo and exoinulin-Rs, glucosaisomerase, pectinase, form, capsule, standard dosage. 2 capsules /r/n/r/n FOD made by Microbiome Labs is our top digestive enzyme pick because it contains a unique blend of specific enzymes to help break down FODMAP foods, groups of fermentable carbohydrates that are common trigger foods for people with IBS. It can be challenging to avoid specific trigger foods, especially when dining out or traveling, so a digestive enzyme can come in handy to reduce potential GI symptoms. /r/n/r/n since FODMAP contains not just 1 but 5 enzymes to help digest the spectrum of high FODMAP foods, it can be a great occasional remedy for those with multiple FODMAP-related reactions. If you have identified a single FODMAP category as your trigger, this enzyme cocktail is likely more than you need to prevent symptoms. /r/n/r/n digestive enzymes must be taken at the start of a meal to be effective, so remember to time FODMAP appropriately before eating FODMAP-rich foods. /r/n/r/n Amazon/r/n/r/n budget friendly /r/n/r/n convenient capsule form /r/n/r/n third party tested /r/n/r/n not recommended for those with IBSD, kidney disease, or heart disease /r/n/r/n may interact with certain medications /r/n/r/n active ingredient, magnesium citrate, form, capsule, standard dosage, 2 capsules, 210 mg each, /r/n/r/n Solga's magnesium citrate tops our list because it is third-party tested and clinically proven to ease constipation. Research has shown magnesium may be more effective than other supplements, such as fiber products, in increasing stool frequency and consistency in those with chronic constipation. /r/n/r/n when taken in doses greater than 350 mg, magnesium gently draws water into the bowels, making stool softer and easier to pass. This is great news for people with IBS-C, whose constipation is often accompanied by excessive abdominal pain and discomfort. /r/n/r/n Solga had its magnesium supplement tested in a 2022 review of magnesium supplements through ConsumerLab.com's voluntary certification program. This verifies that the product contains what it says it contains without potentially harmful contamination. The convenient capsules are also certified gluten-free, dairy-free, non-GMO, and vegan, and at 210 mg each, they are easy to customize your dose. While the recommended amount is 2 pills per day, larger amounts may be advised by a healthcare provider. /r/n/r/n magnesium supplementation is not intended for those with IBSD. It may also interfere with certain medications, including specific antibiotics and diuretics. /r/n/r/n Amazon/r/n/r/n research-backed benefits /r/n/r/n good for all IBS subtypes /r/n/r/n budget-friendly /r/n/r/n thickens quickly in liquid /r/n/r/n not third-party tested /r/n/r/n active ingredient, psyllium husk, form, capsule, standard dosage, 1-3 teaspoons, 6 grams each, /r/n/r/n. When choosing a fiber supplement, the array of options can be overwhelming. Luckily, psyllium husked main, and only, ingredient in Consil's daily psyllium fiber holds the strongest and largest evidence for those with IBS. While many fiber products claim to relieve constipation, the American College of Gastroenterology has highlighted psyllium as the only fiber supplement with adequate evidence for improving chronic constipation. Yet psyllium is not just for constipation, it's been shown to resolve loose stools and urgency and normalize stool form in people with different types of IBS. /r/n/r/n Consil Daily Psyllium Fiber is a readily available, all organic, and reasonably priced option for people with IBS-C or IBS-D. This mostly soluble fiber comes from the husks of Plantago ovata plant seeds, which gel with water to improve stool form, passage, and transit. Unlike some other psyllium products on the market, Consil's psyllium husk is free of sugar, alcohols and artificial sweeteners, which can trigger additional IBS symptoms. /r/n/r/n Consil is available in powder and capsule form, though it may take a larger dose, 5 capsules, to equal 1 powder serving. /r/n/r/n The ground husks can be mixed into prepared foods such as smoothies or oatmeal, but psyllium gels in liquids and will thicken the texture of whatever you add it to. Therefore, it should be taken quickly after blending or mixing to avoid over-thickening. Also, when taking fiber supplements, it's important to ensure you get enough liquids. We recommend starting with a small dose and increasing as tolerated. /r/n/r/n Amazon/r/n/r/n Research-backed benefits /r/n/r/n Convenient pill form /r/n/r/n Flavorless and odorless /r/n/r/n More affordable options /r/n/r/n Larger pills /r/n/r/n Not suitable for some types of constipation /r/n/r/n Active ingredient, calcium polycarbophyl, form, pill, standard dosage, 2 pills, 1250 milligrams, /r/n/r/n Although psyllium is the most clinically researched fiber product, FiberCon is a promising alternative for those with IBS-related bowel irregularities. The main ingredient, calcium polycarbophyl, is a unique synthetic fiber that acts like soluble fiber, gels with water, in the colon. /r/n/r/n This swelling can slow transit time and reduce bowel urgency, a very desirable trait for those with IBS-D who are prone to these uncomfortable symptoms. At the same time, this fiber type has also been proven to normalize stool consistency for those with constipation. And the benefits don't stop there. Research on calcium polycarbophyl also showed reduced abdominal pain in people with IBS. /r/n/r/n FiberCon's pill form is easy to take and a good option for travel and on the go. /r/n/r/n It is recommended to take this supplement with at least 8 ounces of water. Not that it may not be suitable for those with pelvic floor dysfunction, slow motility, or severe constipation. /r/n/r/n There are many different types of digestive supplements available on the market, and matching your symptoms to the appropriate product will help you get the most benefit. Your body's response to a supplement may vary depending on multiple factors, such as diet, lifestyle, health status, dosage, and supplement type. /r/n/r/n According to the latest research, supplements can be helpful for IBS as follows. /r/n/r/n Those with IBS-C, some supplements can improve the frequency and/or form of bowel movements, as well as alleviate bloating, gas, or abdominal pain associated with IBS-C. Examples include /r/n/r/n Those with IBS-D, products intended to slow transit time, bulk up stool, or reduce gastrointestinal spasms offer benefits for IBS-D. Examples include /R/N/R/N those with IBS-M. Those with an alternating pattern of stool habits may respond well to /R/N/R/N those with IBS-related dietary triggers. Regardless of IBS subtype, eating specific foods, such as gas-promoting high FODMAP foods, think beans and broccoli, can trigger post-meal symptoms such as abdominal pain, bloating, and pooping issues. While avoiding dietary triggers may be feasible for some, it can be nutritionally limiting and practically difficult to sustain. Products that can improve food tolerance include /R/N/R/N. Many products make promising claims about resolving IBS symptoms. However, in reality, only a small number of products are backed by strong clinical evidence. We have carefully chosen supplements that have a studied ability to improve IBS management or symptoms associated with IBS. /R/N/R/N. The following supplements lack scientific evidence for helping with IBS. /R/N/R/N. The following supplements still have limited research for IBS management, although more evidence may develop in the future. /R/N/R/N. We support evidence-based and rooted in science supplements. To get our top picks for IBS supplements, our dietitian skimmed the latest research and reviewed top products on the market. We only pick products in line with research-backed guidelines. You can read more about our dietary supplement methodology here. /R/N/R/N. We thoroughly vet all supplement companies to ensure they have in-house or third-party testing to ensure the accuracy and trustworthiness of the ingredients in their supplements. Supplements that are third-party tested are sent to a lab for purity and potency to ensure they contain what they say they contain and do not contain any potential contaminants. /R/N/R/N. Over-the-counter supplements are not the same as prescription medications, which are regulated by the FDA. Check with your healthcare provider before using any store-bought digestive products, as they can interact with a variety of medications and supplements. Interactions vary between products, and it is best to verify before taking to ensure safety. For example, fiber supplements can delay or reduce the effectiveness of antidepressants, diabetes medications, and carbamazepine. /R/N/R/N. Some products may also contain added ingredients such as prebiotics, which can worsen gas and bloating in digestively sensitive people, or sugar alcohols, which can worsen diarrhea. Chewable and gummy supplements are more likely to contain one of these ingredients as a sweetener. /R/N/R/N. Prebiotics, avoid for gas and bloating, include /R/N/R/N. Sugar alcohols, avoid for diarrhea, include /R/N/R/N. The supplements listed above have all been shown to be safe and well tolerated for most individuals with IBS. However, some supplements can cause serious side effects when used in excess. Particular caution is advised for laxatives and fiber supplements, which can cause uncomfortable symptoms and/or health complications when taken in inappropriate doses. /R/N/R/N. Risks vary by specific product as well as individual health status, so it is best to work with a healthcare provider to determine the appropriate dose for you. Some considerations include /R/N/R/N laxatives, /R/N/R/N osmotic laxatives such as magnesium are generally considered safe and well tolerated, though too large a dose can cause bloating and/or diarrhea. Since these types of laxatives draw water into the colon, overusing them can lead to dehydration and electrolyte imbalances. /R/N/R/N laxative supplements may not be suitable if you have the following conditions: /R/N/R/N fiber supplements, /R/N/R/N. While there is no tolerable upper intake level for fiber, concentrated doses can cause constipation, gas, or bloating if you add it too quickly or without enough fluids. Most fiber supplements recommend 8 ounces of water with a standard dose, though individual product directions may vary. Inadequate fluid intake can cause the supplement to swell and lead to choking, blockages, or stool impaction, as well as gas, bloating, abdominal pain, and constipation. /R/N/R/N fiber supplements may not be suitable if you have the following conditions. /R/N/R/N if you are pregnant, lactating, on prescription medications, or have diabetes, consult with your healthcare provider if you plan to take any other digestive supplements for IBS. /R/N/R/N enzymes. /R/N/R/N there are generally no established upper limits for over-the-counter enzymes marketed for IBS. There is no standard dosing for commercially available digestive enzymes, and guidelines vary across different products. Additionally, many products contain ingredients that have not been studied in human digestion and, therefore, have unknown health risks. /R/N/R/N of the most researched enzyme products, documented side effects include gastrointestinal upset, such as gas, bloating, and nausea. High-dose lipase intake, in particular, has been shown to cause damage to the colon walls. When it comes to digestive enzymes, there is no adjustment period, so if you find one is not working, or especially if you have an allergic reaction to any supplement, stop taking it. /R/N/R/N although IBS is often referred to as a diagnosis of elimination, meaning doctors resort to this diagnosis if they can't identify another problem, this can be misleading. While your doctor will likely rule out gastrointestinal infection and disease, a specific tool to diagnose IBS called the Rome criteria also exists. This criteria was developed in 1992 and is periodically updated to characterize the core IBS symptoms, which include /R/N/R/N if your symptoms also meet the frequency criteria, 3 times a month for the past 3 months, your doctor may diagnose you with IBS. Yet IBS is still an umbrella term. There are multiple subtypes of this condition that can feel very different from person to person. /R/N/R/N IBS with constipation, most often experienced as /R/N/R/N IBS with diarrhea, most often experienced as /R/N/R/N IBSM, aka IBSA, IBS mixed type or IBS alternating, most often experienced as /R/N/R/N There is currently no oral supplement clinically proven to target anxiety in those with IBS. However, some products may improve anxiety related to IBS symptoms. For example, the latest research on enteric-coated peppermint oil supplementation showed that daily dosing in adults with IBS improved bowel function and various quality of life measures, including social activity engagement and emotional well-being. /R/N/R/N according to Dr. Fredo, anxiety management can play a key role in getting a grip on IBS symptoms, although the evidence for supplementation for this is lacking. Instead, she recommends yoga, which has been shown to help with both IBS and anxiety. /R/N/R/N there are no vitamins that have been demonstrated to improve irritable bowels. However, magnesium, a mineral, has been shown to improve chronic constipation and may be worth a try if you have IBS-C. By normalizing bowel habits, symptoms associated with being backed up, such as bloating and gas, can also improve. We otherwise do not recommend vitamin blends that claim to target IBS symptoms without clinical evidence to support this. /R/N/R/N by discussing specific symptoms with your provider, you may be able to pinpoint specific dietary or lifestyle modifications that can treat your IBS symptoms without a prescription medication, says Fredo. /R/N/R/N Luckily, there are more options than ever for IBS sufferers, which include a FODMAP elimination diet, gut-directed hypnotherapy, physical movement, as well as a variety of supplements. There is no one-size-fits-all when it comes to IBS treatment, so working with a healthcare provider is important to create an effective, tailored approach. /R/N/R/N Susie Finkel, Mississippi, RD, CDN is a registered dietitian specializing in the nutritional management of digestive symptoms and diseases. She holds a master's degree in nutrition from Columbia University and has trained in numerous clinical gastroenterology settings. As a GI dietitian, she provides evidence-based nutrition services for a wide array of conditions including IBS-C, IBS-D, and IBS-M. Her goal is to demystify nutrition, misinformation and facilitate digestive comfort. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.